Again, I'm Becky Payne, President and CEO of the Rippel Foundation. We are so grateful every time folks decide to join us and are interested in the stories we get to share and lift up. We see ourselves as just connecting dots and so fortunate to be able to spot and lift up the stories and wins and struggles of each other. So if you're new to this Toolbox series, just a little bit of light grounding. We only have an hour. It's never enough time. But you get to hear directly from folks who we refer to as stewards. So if that's a new term for you, you don't need to know the definition, but we like to talk about stewards. We see stewards rising everywhere across the country, and we take this time to spend an hour together lifting up those stories. You will get to ask questions. We encourage you to be active in the chat. We hope you gain some actionable insights, and you'll get to learn and take inspiration from what our colleagues are doing, their experiences and their challenges. This is not a deep dive. We're happy to have follow-up conversations with you, encourage you to connect with each other so that you can have more in-depth problem solving and sharing, and we love to hear your stories. So please feel free to reach out to us another time. We've got a great lineup of speakers. I am going to share just a couple of remarks at the top, and then you'll hear from Jasmine Hutchinson from Loma Linda University Health, Esther Pitts from Matsu Health Foundation, and our very own Tara Oakman will then lead us through a little bit of a fireside chat format. And again, we're going to encourage your questions and comments in the chat. We have team members who will respond to you live in the chat when they can, and we will lift up some of those questions, time permitting, in the fireside chat. So before we get started, again, we've been doing this series now for quite some time. We're so thrilled every time you keep returning and we keep finding new friends in the journey. We've been through a lot of ground with this series, and you can find those recordings and additional background material on our website. We'll share the links to those Learn by Topic pages. But just so we all have a little bit of a shared grounding, we have 3 core frameworks and purposes here at the Rippel Foundation. The first that's very important is why we do this work. We believe fundamentally that there is a future that is rising and possible where we all thrive together. That means working together to radically reduce the experience of struggling and suffering among our community members. What that takes is working together to uproot and replace our places and the power structures that hold conditions in place that prevent that from happening. Actively working to replace that with the vital conditions for health and well-being, for health and justice that make thriving possible. And how we do that is just as important as what we do. And so we talk a lot about shared stewardship. There's that word again. How we show up in right relationship with each other to connect across our differences, create opportunities for learning and growth and adaptation, and put those together, and we call that shared stewardship. And shared's really important because we do all of this work together. What we are trying to do to realize a future of thriving together, all people, with no exceptions, is only possible if we join with others. We've had content on those through the course of this series. You can go back and rewatch and learn through tools and resources on our website, but those are some of the words and frameworks you'll hear us use today. Before we jump in, some of you who follow us closely may have caught, and we're going to share more publicly, more vocally, that we've been thinking a lot about that global aspiration of a future where all people and places thrive together with no exceptions. That North Star absolutely guides our work day in and day out. We believe and demand that that future is and will become possible. And we also recognize that the urgency of this moment calls for something more. So we've been thinking a lot about how we speed that process up, how we hold ourselves accountable to having the courage to really make the kinds of changes that will make progress on that future. We recognize that right now we're not doing so well in a lot of ways. You could fill in a lot of blanks for that. We particularly look at the number of Americans who are thriving, and we've headed in the wrong direction in the last few years. We'll say more about that in a moment. But we like to think about the future, and we like to think about the future we deserve and demand. And so we are calling others to join us in thinking about what it would feel like, what it would look like if we imagined celebrating a 20-point increase in the number of Americans who are thriving just in the next 10 years. We started talking to folks about that about 6 months ago, and we were met with great inspiration, resounding yes, count me in. And we hope we can count all of you who've joined us today in the ranks of those who are working with us and working together independently and together to make that a reality. A little bit of what we heard I'm going to share just because it's inspiring. You see some quotes on the slide, but there were themes of what emerged when we asked people, why were you so eager to join with us? And they recognize that there is an urgent opportunity, that this work is already happening, and yet the resounding stories we hear don't tell the good work that's happening on the ground. So there's an opportunity to lift that up and make it more visible so that we know we're not alone. We saw stories of that this weekend with the protests across the country. There's a moral imperative that this is just the decent, humane, fundamentally right thing to do, that we all deserve to thrive. It represents sound strategy for some, that there is a financial reason that this makes sense, that we are all better off financially, morally, spiritually, if we can come up with a way to realize this future. And that there's an aspect of community, that we get to connect with others. Taking on a bold goal that is so ambitious cannot fundamentally be done alone. And so joining in community in service of our fellow citizens and each other is incredibly inspiring. So for us, it gives us just the right mix of purpose, urgency, and accountability. And we're pleased to share what is not our goal, but it is a community goal, a nationwide goal, to try to really, with intention, impact this number. Next slide, please. And I do want to say it's more than just a number. The number is a feature. It gives us urgency. It gives us a goal and some accountability. But more importantly is that we do know what it takes to increase well-being and thriving. And it is about investing in four things. So I want to invite all of you to think about this, to think about the role that you might play within your networks, within the power that you hold, within the community that you sit with. If we can collectively start with intention investing in these four things, we will see that number rise. The multi-solving power of belonging and civic muscle. Again, we've talked about this a lot. Our current series, season of Unsung Stewards, our podcast, which the first episode drops this week, is entirely devoted to belonging and civic muscle. So I hope you'll pay attention to those episodes. Shifting investments into those vital conditions I mentioned for everyone, with no exceptions. We leave no one behind on this journey. That means we have to design systems and redesign and uproot systems so that they are fair by design going forward. There is no compromising on that value. And then adjusting what is often very necessary. We don't ever want to leave people in pain and suffering, but an over-reliance on urgent services has emerged in this country. I think all of us recognize that we pour into these, of course, in times of need. And then sometimes we get confused or just incapable of making that bridge to creating the investments in those vital conditions that help us have a lower need, a lower requirement for those urgent services, because those urgent services are necessary, but they're never enough to help somebody thrive, if we're honest. I don't want to live with just those conditions in my community. Seeing somebody who is unhoused or going through addiction is heartbreaking. And even if I am doing well, I actually am not thriving while I'm having to encounter and stand by with that suffering. And so those urgent services are important, but we have created systems where we think that that is enough, and we don't go the next step to invest in the intergenerational systems through those vital conditions that will get us on a path toward everybody thriving together. So those four things are what we're going to be calling folks into, lifting up stories, helping you think with us about the strategies and opportunities to further invest in those, and we want to tell your stories along the way. Next slide, please. So as I come to a close, I just want you to know we've been watching what we call a rising movement to thrive together. And I say we in the broadest sense. This isn't just Rippel. Many of you, some of you in this webinar and many beyond us, have been using the vital conditions, rallying around thriving together, and practicing shared stewardship now for 4, 5, 6 years. So it's an emergent, relatively new trend, and yet look at this map as it fills in. We know that there is work happening. I think if you click one more time, please. We know that there is work happening across the country. We want to fill this map in. So if you're doing this and don't see yourself represented, You're going to see in the coming weeks an opportunity to help us build out a crowdsourced map, again, so we can see each other. We are stronger when we are together. There's also a growing list of national organizations who recognize that these frameworks are profoundly powerful organizing tools. We make them our own, we adjust, and we move forward together. And we're so pleased that today you get to hear from two of these stewards, two of these bright spots among the many, our friends in Loma Linda and Matsu Foundation. So I am so thrilled to hand it over to Jasmine from Loma Linda to share with her. We're going to be talking about community health needs assessments and using the vital conditions and what that has unlocked in just a couple of communities. We know others are doing this work. Again, please share with us in the chat. And I am excited for the next hour. I'm going to let you take it away, Jasmine.
Thank you so much, Becky. My name is Jasmine Hutchinson. I'm the Community Benefit Director at Loma Linda University Health, a Seventh-day Adventist academic health system that has served the Inland Empire region of Southern California for more than 120 years. Next slide, please. Our system includes 6 hospitals, a level 1 trauma center, and the region's only dedicated children's hospital. We're also home to Loma Linda University, which is preparing the next generation of healthcare professionals. Next slide. The region we serve is geographically expansive and has one of the fastest growing metropolitan areas in the country. If the Inland Empire were its own state, it would rank about 25th in the nation by population. It's demographically diverse, majority people of color, and predominantly Latino. Because of that scale and diversity, our health system serves as a major trauma, pediatric, and academic health hub for millions of people across the Inland Empire. Next slide, please. Our region has been an early adopter of the Vital Conditions framework. It's helped bring people together across sectors around a shared vision that all people and places thrive, no exceptions. We're using a common language and finding new ways to work together through this network of networks. Next slide. At Loma Linda University Health, we've been integrating the Vital Conditions framework into our community benefit work since 2022. We've used it to more deeply understand our own work, prioritize what matters most, identify new opportunities for collaboration and impact, and align our messaging across all of our reports and work. Next slide. During our most recent CHNA cycle, we completely reimagined our approach. We wanted a CHNA that doesn't just sit on a shelf, one that feels alive, like our community. It's readable, it's visual, it's rigorous, but most of all, it's useful. We approached it not just as a report, but as something that felt like a magazine, even a love letter to our community. Our goal was for people to feel seen and heard, to know that their story was being told with care, and to understand that our commitment is long-term. We also didn't do this alone. The CHNA was a deeply collaborative effort. More on that in a minute. We integrated the Vital Conditions into every CHNA tool, from surveys, community conversation, and key informant guides to the analysis, and finally, the report structure itself. We use the framework to identify new experts to interview and populations to reach. Let's be honest. The data that we use for our CHNAs are often at least a couple of years old, if we're lucky. While that data is important to include, it really doesn't tell us the full story of what we need to prepare for our communities to thrive. And that's true now more than ever. Last year's Medicaid coverage rates are not predictive of next year's. Food insecurity rates from 2 years ago are not predictive of 2 years from now. If we're only focusing on data, then we're missing major threats and opportunities. It was so important for us to ask, what are today's biggest threats and opportunities for our community? We also balance needs with strengths by asking community members about their assets in their communities and making sure that those were reflected alongside the challenges. It also meant cutting content that felt redundant and unhelpful. We really wanted to focus on clarity of purpose, uplifting the most pressing issues in our region, our community voices, and amplifying the importance of work already taking place in our community. Next slide, please. We heard from more than 1,300 people across our community through surveys, community conversations, and key informant interviews. Next slide. And we absolutely could not have done this alone. Our Loma Linda School of Public Health was a critical partner in the research. We also partnered with more than 30 community organizations. We compensated participants and organizations who invested significant resources for their time. And we're also sharing back the data in ways that are useful for our collaborators and our key partners so that they can use the data to support their grant applications and develop more nuanced strategies in their geographic regions. Because at the end of the day, this isn't just our CHNA, it really belongs to the community and to our partners as well. Thank you.
All right, Jasmine, thank you so much for that. Just so everyone knows on the call, we did a kind of a dry run before, and unfortunately, I should have asked to go in front of Jasmine because it's really hard to follow that. But thank you so much for outlining that. Hi, my name is Esther Pitts. I'm the president and CEO of Matsu Health Foundation. Next slide. I'm going to give you a little bit of who we are first. So I want to talk about a place called Hatcher's Pass. We in Alaska really tie most everything to nature and to place. So here on the screen, I just wanted to show, again, a place that many of us go to for recreation. It really does talk to the fiercely independent nature of us here within Alaska. As well as the call to help each other. So you'll find some of the most independent people here, and then also some of the most helpful that are really tied to their neighbor. Next. All right, let me just go into what we are as the foundation. So the Matsu Health Foundation is a place-based funder, which serves what we call the Matsu Borough here in Alaska. So we're a region that's roughly the size of West Virginia and have approximately 118,000 residents. We are the fastest growing borough in the state of Alaska, and where others are seeing a decline from really residents as well as births, we're seeing an incline. In Alaska, there is over 200 tribes, 227 tribes, with two of those tribes residing in the Matsu. One of them is the Chicaloon tribe, and one of them is the Kanik tribe. So here at Matsu Health Foundation, our roots trace all the way back to the original Valley Hospital, which was created in 1948. We then transitioned to an equity partnership as our community started to grow in 2005. We are still a joint venture owner of our local hospital, and we did our first community grant in 2006. You'll see the programs here. Our work includes grant making. We have a really robust scholarships program. We have two diverse programs. One is ROCK, which is raising our children with kindness. And then we also have Connect Matsu, which is a really, it's an information referral and connectivity organization. We organize our efforts across healthy minds, healthy families, healthy aging, and healthy foundations. What we've learned, though, is that these categories alone don't fully capture what drives long-term thriving. Next, please. I'm going to read this. I typically don't read verbatim, but it really is something that here has impacted how we work in community. So when we center the vital conditions framework as a tool to provide clarity on building thriving communities, our ability to impact sustainable change really ignites. Next. So I want to give credit, even though I don't believe that she'll have to listen to it after the fact. So we have a director of evaluation and learning who really stewards this community health needs assessment process and has done a stellar job in really leaning into community. We have a very transparent process that we do, and we really endeavor to engage community voice in a more intentional way every single time we do this process. And I would have to say that this last community health needs assessment really blew all expectations out of the water. So here is just an overview of really what our CHNA process looks like, and how we ensure that we are not telling community what their strengths are or what their needs are, but really ensuring that community has a voice in a modality of ways. Next, please. All right, so I've told Becky this many times with the Rippel Foundation, but when I first came to Mat-Su Health Foundation, I've been in this role for almost a year now. I came from acute healthcare, running a children's hospital and outpatient clinics. The vital conditions and the well-being portfolio was something I instantly latched onto because it provided a level of clarity. It provided a level of really centering and ability to speak across multi-sectors in a way that brought, again, just a heightened level of focus to what we do. So this is actually listed out when we were talking about our CHNA process. The foundational piece is the vital conditions. It is the well-being portfolio. And so the structure really is something that we have across our Mat-Su borough, and even within the state, to be able to ensure that when I say vital conditions, or when our team says vital conditions, people know what we are talking about. Next, please. All right, I just wanted to show a little bit here. So yes, the CHNA, all things we do really tether to this framework. We also do all our reporting really in the same vein, because to Becky and to Jasmine's point, if we really want thriving communities, we are, number one, going to be measuring how are we doing. We know that some of this change is generational. We know that some of this change is hard to be able to give a really quick, oh, here's what we're doing to our boards, to our community. And so our goal is to continue to shift and show what needs are, so that as we look at the vital conditions and as we look at urgent services, it gives us a good litmus test on, are we continuing to focus on areas that will help our community thrive? Or are we at the urgent conditions where we're just going to be constantly putting out fires? Next. All right, so I want to talk a little bit about, so we've shifted really from a needs-based approach, and we are continuing to shift from a needs-based approach to a condition-based approach. So something that our team did, and Danny, who's one of our lead people, did, instead of asking and going into community and saying, what is the problem? Asking what conditions need to be true for people to thrive. And that was also looking to the strengths-based piece. What's going well? Like, why is this community doing so well, or this subpopulation in community? When if you looked at it from the outside in, you might think, oh, wow, we need to jump in and fix this. The vital conditions framework really provided us the ability to have clarity, alignment, and structure for this sustainable impact. One area that I'll touch on it, I know that I'm going to transition here in just a second. It really was centering belonging and civic muscle into everything we do. It reflects not just a change in funding, so as we look at the vital conditions and the urgent emergent, but it really showed how we are looking at impact and how are we defining this shift that we have. So again, our CHNA focuses on conditions now versus just isolated needs. And it really allows us to integrate the data and the community voice into a more cohesive strategy. So here you see, this is a sampling of areas that were connected in the Mat-Su Valley with the CHNA process as well. Next slide. That's it. Thank you.
Thank you so much, both Esther and Jasmine. So I'm Tara Oakman. I'm Senior Vice President of Strategic Initiatives in the Rippel Foundation, at the Rippel Foundation. And it's my honor to moderate the fireside chat and really just continue to lift up the inspiring examples that Esther and Jasmine offered from the Inland Empire and the Mat-Su region. I just love the imagery of a CHNA being a love letter to your community, and also the conditions-based and asset-based approach that Esther offered. So Becky talked about our bold goal at Rippel, our invitation to imagine a future where we can celebrate a 20-point increase in the number of Americans who are thriving in the next 10 years. And we recognize this is a really big vision and that the work is already happening, just as you heard from Esther and Jasmine today. What I love about what they shared is that they showcase really concrete examples of what stewards, and again, you don't have to get anchored in that term, but what all of you on this call and others, what you're already doing and can do more of, what you can unlock by organizing and investing around the vital conditions for well-being and really centering belonging and civic muscle. Community health needs assessments offer, just like they both shared, really a perfect example of a process that's already happening that can be leveraged and do in a much more meaningful and holistic way together with your communities to shift investment and attention towards what all people and places need to thrive, starting with those who are struggling and suffering. So with that, I do want to turn it over to our questions. So the first question, and I'll start with Jasmine, is if you can share more about what organizing using the vital conditions framework made possible in your CHNA process.
Absolutely. The big thing is that organizing around the vital conditions framework really helped us stay centered on what mattered most. When you're working on a CHNA and sifting through thousands of pages of data from so many different sources, it's just so easy to get lost in that complexity. The framework really helped keep everyone aligned. We had a team working on this, and it ensured that we were using the same language, focused on the same priorities, and moving in the same direction. I also want to say a huge thank you to the Rippel Foundation, Robert Wood Johnson Foundation, and others who've helped design and launch this brilliant framework and also foster this national network. It feels like we're connected to a larger movement, and that's been really helpful in our work. We were actually able to draw on well-being survey questions developed by Fox Cities, Wisconsin, and adapt them for our own CHNA, which was incredibly helpful, knowing that they had already been well tested. One of the things that I found most interesting about the framework itself was how much it resonated, not just at the organizational level, but with our community members as well. We brought handouts of the Vital Conditions Framework to our community conversations, our focus groups for the CHNA. We used them to help explain the framework and then ask people about their priorities. Even after we had moved on to other questions, they kept coming back to it. And one of the most common questions we heard at the end of the focus groups was, can we keep this handout? And that told us that it really landed because it was clear, accessible, and meaningful in their own lives as well. The framework has also really helped us look beyond the traditional health silo. We've been doing CHNAs for about 10 years, and it's easy to fall into a pattern of just updating the same kinds of data. This framework challenged us to more deeply explore areas that we hadn't focused on as much before, but that are critical for our communities to thrive. Ultimately, the Vital Conditions Framework helped us treat the CHNA as a catalyst for change, not just as a report, but as something that can drive action and inspire new partnerships.
Thanks so much, Jasmine. What about you, Esther?
Yeah, definitely. I hear a lot of similarities. So it did bring clarity, right? So it really brought clarity by organizing what is very often complex needs into a system view versus just lists, which we really saw the impact of that. And to Jasmine's part, it did create a high level of alignment across the board, staff, partners, community through that shared language piece. Um, it enabled integration by showing, again, how issues like housing, behavioral health, and economic stability are interconnected and not just siloed of themselves. It really did shift the fragmentation of efforts into coordinated strategy. One of the benefits that we didn't anticipate necessarily, but we saw is the vital conditions framework. It really harkens to those that are looking at from a business standpoint as well, which was really helpful in my role as talking with the board, talking with business partners. It made sense. And sometimes philanthropy doesn't make sense. It feels a little too squishy to people that are on your board or to the state partners. And so this created kind of an aha moment on like, oh, okay, this makes sense to us. We can follow this. So yeah, it was beautiful, and a lot of possibilities came from using this as our grounding piece.
Thanks so much. As someone who's worked in philanthropy for a long time, I totally hear what you're saying, and appreciate what both of you shared on how the framework helps to stay focused in a way that really matters to community, resonates with community, and also resonates with other partners to really help break across silos and cultivate partnerships. Thank you so much. So I'm going to turn to our next question. And I also just want to make sure that everybody here knows that I am going to be turning to you all for questions. So if you want to start thinking about that or sharing in the chat, you're welcome. So the second question, and this time I'll start with Esther, is if you can go a little deeper on the belonging and civic muscle and tell us what it looked like for you to center belonging and civic muscle throughout the CHNA process.
Absolutely. And again, I'm just gonna give a lot of praise and credit to our amazing team that again shepherded this process. We actually embedded belonging throughout. Belonging and economic mobility were the two that we focused on, but really put it throughout the entire CHNA process. We know and we've found that belonging is as impactful as any formal service out there. And we've also learned that the services that have the most tangible impact are the ones that have developed strong connection with those that they serve. While experiencing social isolation undermines any efforts or resources. It's almost like belonging is that secret sauce or that magic that it's almost hard to identify or put your finger on, but if it's not there, you see it. Belonging happens at the intersection of health, family, and community. Individuals' well-being cannot be separated from family and community context. Caregiving is inseparable from family unit health, right? So we know also that family structure and peer networks shape recovery and belonging. Residents really found purpose through advocacy opportunities and meaningful employment. So we outlined how belonging specifically showed up in each of the 6 top CHNA needs, as well as how belonging in each of these areas have shown to increase outcomes and success. So that's going to meet the needs of your like big heart and also your big critical thinking. So what that did for us is it required a shift in posturing from like funding to participating in community dialogue. We focused on inclusion by identifying missing voices and creating space for them. And then it really did create a lot of trust as we talked through this. I'm going to give you a really quick piece. One of the stories that impacted me more than anything recently was a gentleman who talked about, it was suicide prevention. And we were talking about the statistics, right? We're talking about the data and all the piece. And he had a shirt on that said, "Hey, Bob, what's up?" And he said, "You want to know what this is?" He said, "I was in high school and I was walking down the hall and I had decided I was going to go home and kill myself. And he said, there was a boy across the hall who called out to me and said, "Hey, Bob, what's up?" He said, feeling like I was important to somebody caused me to hold on, and it changed the course of my life. And so those moments of belonging, whether how deep or how shallow at times, really do create a tremendous amount of our outcomes that we see or don't see. So that again is what it looked like for us. And really, I appreciate the Rippel Foundation so much for creating the belonging and civic muscle. It doesn't matter what else you do. If you do not have this belonging piece in it, we will not have the desired thriving communities that we're looking for.
Yeah, thank you so much. And your story gave me chills. Jasmine, turn it over to you.
Wow, Esther, I've been thinking about that even since our last connection point. The storytelling that you all have woven in is, I was over here taking notes last time. So I have been in awe of what the folks at Matsu have been working on with their CHNA as well. So we tried to center belonging and civic muscle in a few different ways. One was in how we structured and wrote the report itself. We really wanted it to be accessible, so we moved away from a lot of dense charts, and we've had that, which we've had in previous cycles, and instead created one-page infographics on each of the vital conditions with very visual spotlight pages to make it clear what matters most for our communities to thrive. We also wrote most of the report at about an 8th grade reading level to make it accessible to more of our community members. In addition, we also focused on building stronger awareness and advocacy within our own system. We collected about 20% of our surveys in our own emergency departments, which was the very first time we've ever done that. We really wanted to understand whether the patients coming into our health system truly reflected the broader community. And in our case, they absolutely do. But when we pulled that data, we actually did a deeper analysis on just the emergency department survey data, and we shared it back with our emergency department leaders. The survey goes into far, far more depth, right, than what our emergency department leaders have had a chance to look at in the past. So the results were really eye-opening. And this helped build stronger advocates within our system and shift how our leaders understand the level of unmet need in our community. It's creating urgency, opening new pathways for collaboration, and sparking conversations about what we can do to respond as a system. And then we've also been really intentional about sharing back data with our partners. We have organizations focused on serving specific geographical areas, for example, one county or another county, or who are working on specific topics like housing, for example. So we've been able to pull subsets of the anonymized data and share it back in ways that they can actually use to better serve our community too, for grant applications, for their own needs assessments, and for shaping their strategies on the ground. That's really how we're trying to make sure this data actually belongs to them as well.
Yeah, thank you so much to both of you for really illustrating the heart space and power of building and cultivating belonging and civic muscle, and really centering people's needs, their lived experiences, their stories, and how the data can be a tool for cultivating belonging in and of itself. So I'm going to be turning to our third question, and again, just want to remind everybody, if you want to be adding questions to the chat, I see one already, which is great. So the last question before I turn it over is, what example can you share on a change in strategy or investment that resulted from organizing the community health and needs assessment process around the vital conditions framework? And Jasmine, we'll start with you again.
Great. So there's a lot we've already done. We've reorganized our community benefit grant making to align with the vital conditions framework, and all of our direct programming is also advancing the vital conditions. Every year has really been a chance to do something a little bit differently and a little bit more deeply. And in this next cycle, we're really planning to more explicitly focus on belonging and civic muscle and how our investments, our grant making, can support those. Where things are really starting to get interesting for me is how we're beginning to weave networks together that haven't historically worked together. I think part of this is the shared language that we've been building collaboratively with the large group of stewards who are part of the Inland Empire Vital Conditions Network. But let me give a more concrete example. So what we've often found is that some of the most intractable problems, they often fall between different networks and different sectors. And so we've been hearing from the maternal health network in our region that they're really struggling with housing for pregnant and postpartum patients and their families. There's not enough of it, and the housing that does exist often isn't the right fit. And you can't bring a baby into a large shared space, for example, right? So we brought that network together with our housing coalition, which represents more than 300 members working on housing solutions. And we're starting to hear some really interesting ideas for how they might work better together to solve this issue. These are groups that didn't necessarily know each other before. And now there's this shared understanding of the need and a willingness to find solutions together to better serve this vulnerable population. And one more thing, I am also starting to think about how can we leverage our own size and scale as a health system to better support our community partners. We have a large workforce, about 20,000 people, and we're exploring how we can create more defined pathways for our staff to engage with community organizations. So for example, organizations like Big Brothers Big Sisters and CASA, they're always in need of long-term committed volunteers. And in many cases, that support can be just as critical as funding. So it's really about thinking how can we, connect the dots and lean into Loma Linda's deep culture of service to better support our communities.
Awesome. Thank you so much, Esther.
Yeah.
What would you add?
So I would say the strategies and investments that resulted is one of the big ones is all of our data really is categorized around the well-being portfolio and the vital conditions. It is for us a strategic pathway to continue to shift our finances and our work towards the vital conditions as a measurement of success. And it's something that we talk a lot about accountability internally here, and that's one of our accountability metrics. An example specifically of that is really, and then, hearkening to the belonging is youth and behavioral health. We have a couple programs. So Youth 360 is a program, and it really is focusing on belonging. We have another program called Hello Baby, which is talking about social support for moms before they even have children who are pregnant and who are needing to just have a connection. So again, we're looking at it's shifted how we invest. It's shifted more even than our investment is how we're thinking about some of these issues, right? So it's an integration of the services. It's an integration of the belonging and also giving those in community a voice. So one of the things that vital conditions with our belonging and civic muscle, I was recently in Juneau, which is where our, the legislators are, and they're in session right now. And I was talking with some people up there, and I said, yeah, we're here and we're giving voice to our community. And he said, I want you to think about that. He said, is it your job to be their voice or to ensure that they can actually show up and be a voice for themselves? And this is really what the belonging and civic muscle talks about. Sometimes in philanthropy, and I myself have thought it, oh, we're here to be the voice for the voiceless. Yes, and it is our job to make room for those that are voiceless to be able to speak for themselves. And so that has been a tangible shift in our behavior and how we're looking at things. We also identified that outcomes are tied to conditions like belonging and safety, not just services. So our investments have shifted. We're investing now in things that are focused on social isolation. We're focused on things that are around resilience, around cross-sector collaboration, and our success now is measured by improvement in conditions, not just by programmatic outputs.
Awesome. Thank you so much. I heard so many great examples in what both of you shared around how you are incorporating longer term strategy, how you're weaving networks together, cultivating relationships, and really leaning into how you can support and elevate and earn trust from community and people with lived experiences who have often been marginalized. So thank you so much to both of you. So we are getting some great questions in the chat. So thank you for that too. It looks like the first one was answered. And so I'm gonna go with the one from I believe it's Kara. It asks if the presenters can speak on the process of building trust and relationship within communities that allowed for their essential participation, and speak a bit more on the extent to which CHNAs and related data have been shared with community participants and how. So it's really building on what you started, Esther. Do you want to maybe take that and then we can bring it over to Jasmine?
Yeah.
Okay, thank you.
So in a plethora of ways. So what I would say is, again, we're really focused on cross collaboratives. So there is a roadshow of sorts with the CHNA that is ensuring that we take this back. Not just we had a group of people. I think there were 16 different partners from different organizations who were part of the original steering committee. So all the information all along the way has gone back to them. But in community, we are still in the process of going into our goal is to go into the neighborhoods, right? And to be able to share this data. We're really good at touching nonprofit leaders. We're not as good in going into the communities themselves and bringing this information. And that's a process that we're working on right now. And we've seen it a little bit as a gap. And so the hope is to have a roadshow to go in. And one of the things we want to focus on is there's these people that we're touching and that are giving their feedback. They're not the ones that are drinking coffee in the coffee shop at 10 a.m. and you could go hold a book club and they all come. We want to make sure that we are able to touch those that are asset limited. They're working 2 jobs. They have childcare issues. We've got a lot of transient leaders. So we are going to be doing again, a roadshow, but we're going to do it in a way to touch as many people as we can. So that was the first part of the question. Was there a second part that I missed?
There was, yeah. Sorry, hold on. I'm scrolling back to more on the data, how you share the data with community participants and how.
Yeah, so the community participants piece, I think, is the area that we're going to focus on the most. We're also sharing the data. We went to Juneau, where again all our legislators are, and we gave out, like, this is a amazing and huge book. So we actually brought this and we showed them, because what we want to be able to do is say, hey, you're going to hear from your community. This is what they're saying. And so we're better. This is what I would say. We're better at the nonprofit leaders and our like legislators and our hospital than we are at the community. So I also want to hear what any ideas they have. And then also, Jasmine, anything that you have that you're doing that we could pick up on as well.
It's such a great question. Let me answer the first part. So in terms of building trust and relationship with communities, again, a huge piece of it is the ongoing relationships that we have with all sorts of partner organizations in our region. This would be completely impossible without them, because they're the ones who've truly built that trust with different communities. And they're the ones who've helped us organize community conversations, find, participants who've helped, some of them have helped us collect surveys, and they're out in the community tabling. So, for example, we work with folks who, a network of organization that focuses with community health workers. And they've been absolutely instrumental, and they're all over the region. But we also made sure that we were reaching out to partners who serve different populations that may not be, to make sure that we kind of have a lot of the demographics and populations covered. So groups that work directly with people who are unhoused, and folks who are working with maternity patients. So kind of a broad group. And without that, it would have been impossible. And those relationships are, those are relationships that are so critical to us. We are constantly looking for ways to support and strengthen throughout the years, and not just going to them once every 3 years and asking, will you help us with this needs assessment? So that's number one. In terms of, I will say, I think it's a gap right now. The second part of your question, which is the extent to which the CHNA has been shared back with community participants. In the past, we've done kind of town halls. We've done it in Spanish before. The hard thing is getting back to the exact same groups that you collect, you got the data from, because the data was anonymous. And we're really intentional about protecting identities and things like that. So we've been, sharing out with our partners. We've asked our partners to share it out with the same participants, if they can, that came to our community conversations, so that, get them at least back to those folks if possible. And we're trying to, share the CHNA in as many different platforms to try to reach folks directly in our community.
Thank you so much.
I would love to learn more about how other folks are doing this well. It's hard.
Always more to talk about. We do have a question about the thriving metric, which I see you answered in the chat, Jasmine. So I'm going to keep going. But Esther, if you want to, you could also respond in the chat if you were able to, about using the thriving measure. I'm going to go to Lizzie Hennessy's question about whether you've gotten any pushback from healthcare in shifting grants and shifting sponsorships to the vital conditions and out of urgent services, and how that was mitigated. And I know we only have 4 more minutes, and that's a big question, but it probably is something a lot of folks are curious about. So if you can just maybe briefly touch on any pushback you've gotten.
Sure. We haven't gotten any pushback, in part because our office, our institute, is the ones that lead that process, and we have a large team, maybe 25 folks who participate in it in some way. But so it's been kind of a natural extension. I think our institution, whole person care is a big part of their values, and so they certainly see this as part of the shift to the vital conditions. I think makes sense for a lot of folks who see it through that lens of whole person care.
Well said. I would say we also have not gotten any pushback as a joint venture. So we're part owner. We take our proceeds and put them directly into communities. So there's really it would be vetting of our board, right? So if the board had an issue, but again, I really want to hone in on, I think it's an important piece that as you're trying to really build the storyline of why this is important, this is not just oh my gosh, I know it's important because it is. Like, there is data, there is, I think you can meet the need for anyone you want to go to, social determinants of health. So there has been enough work done to where, again, to Jasmine's point, our board, our community, and our healthcare partner because of all of the pieces that we can put out, that this is really baseline for having a thriving community and a thriving person. And so no pushback at all. It's, if anything, the trend has been even more to lean this direction, because just empirical science of dealing with an issue without taking the person into consideration has not worked. And so if anything, we have so much momentum behind us, and to be able to utilize the expertise of those who have been in this philanthropic world to lean in and have really great results.
Awesome. Well, thank you so, so much to both of you for the work you're doing and the stories and examples you have shared. It is truly powerful and inspirational, as you can see from many of the comments in the chat. For those of you who we didn't get to your questions, we can follow up with you. Tiana, if you want to you're welcome to share the slides. So just to round back out on the key takeaways from today, setting up the importance and clarifying moment of setting a bold goal to make progress on thriving together, and how that can bring intention, impact, and urgency that this moment demands. And another key takeaway that we've heard from these examples is how organizing around the investments in the vital conditions through the CHNA process can help to motivate staying focused on community, making the work of transformation more tangible, how it offers an opportunity for long-term strategizing with partners, and how it's critically important to really lean in on the multi-solving power of belonging and civic muscle. So thank you all so much for being here. We do want to ask if you can please respond to our survey so that we can continue to get better as we improve these sessions for you. I believe the survey is going to be shared in the chat, and we are also, there it is, and we are also going to be sending a follow-up email with the recording and resource materials. So look out for that, and please do be sure that you're on our mailing list. And contact us if you have additional questions, and we will be sharing more on opportunities to engage, hear from others, and ask your questions. And really, we want to hear from all of you on the great strides you're making towards the movement to thrive together. So thank you all so much. Be well.